Okay, now having talked about the children, what about parents themselves that are in? Is the parents that are the addicts?
Yes. It's a worse scenario because as a father or as a mother, as a parent, when you are into it and you have children,
I mean,
probably you do these things to before them and they see you doing it. How can you then tell them not to do it?
exactly.
You understand? So this is a worse scenario because as a parent, you're supposed to be a responsible parent.
Live by example.
Live by example. I cannot be taking alcohol and I see my child taking alcohol. I say, no, don't take. My child will ask me then, why are you
Why
taking
are you taking it?
Yes. If it is bad like that, why are you taking it? And our children are so intelligent. Children of these days, they are different from children of yesteryears.
Absolutely.
Because they are moving with time and a lot of technology.
That's right.
Technology, yes. So you just have to be a responsible parent. When you advise your children not to smoke cannabis, for example, you should not be seen smoking cannabis. When you say don't take alcohol, you should not be seen taking alcohol. When you say don't take cigarette, you should not be seen taking cigarette, and things like that. Because you cannot tell me that these things are bad as a child, and you, as my father, you are taking it. I cannot just comprehend and understand what you are saying. But when you say it's bad, and you are not taking it, I will now tend to believe that this thing probably have medical consequences and social consequences.
Okay, sir. I would like to take it to another level now. There are some drugs that are gotten over the counter.
Yes.
Some of these illicit drugs, even.
Yeah.
Like there are some, what I call them chemists, local chemists, where all of these are
even
sold.
Pharmacies.
Even pharmacies.
Yes.
Do you go? Do you get to? What extent do you go to? Fetch out such?
We do. We have a lot of psychotropic drugs in our society that is being abused. We have, for example, we have rohypnol, we have diazepam, we have tramadol, we have all.
Yes, that's a common. That one rings the bell. Tramadol.
Yes, tramadol, and a lot more.
Codeine and all that.
Cough syrup with codeine. And,
but sir, cough syrup with codeine is a legal drug.
Yeah, it is a legal drug. But a lot of people are taking advantage. Codeine is actually to reduce pain in you and all this. For those people that have dry cough, more of if you go to hospital, you see a doctor prescribing cough syrup with codeine, so that when you cough, it relieves the pain in your chest area. Your chest. So, but codeine has the tendency, when you take it today, you take it tomorrow, there is tendency that you develop addiction within a short period of time.
Really?
Yes.
Wow.
So that is why even doctors are careful to be prescribing this thing with codeine.
These days, yes, they are.
Now, a lot of our youth have realized that they buy codeine on their own without even prescription, cough syrups with codeine, 1, 2, 3 bottles, and they drink it. All they need is that codeine effect in them, you understand? And it makes them high, you understand? And that is why today, the syrup that is most abused in our society today is this cough syrup with codeine. Cough syrup, virtually, if you go to Kuarumpa area, we've raided the place separately. The moment you park your car, you see a lot of them, youths, coming with this thing. You want to buy, tell you, and it's sold at 3,000 naira per syrup bottle of codeine, So we have a lot of drugs that are banned. Talking about the over-counter drugs that you are talking about, and this, well, as a pharmacy, I'm talking about pharmacy now, not chemist.
Okay.
We have over-the-counter drugs, and we have drugs that are controlled, because a pharmacist has the powers to dispense even the ones that are controlled.
Okay.
But it has to be strictly on doctor's prescription.
Right.
But those that are controlled, you're supposed to have what we call a poison box. That is where they are being kept. You don't keep them over the counter, because they're highly controlled. It is only the pharmacist now, in this case, that will have access to that box, and dispense it to customers when they come on prescription, on seeing prescription. On no account should you dispense those drugs that are controlled to your customers just because they walk in and give you, you just take it and give it to them. You are going to be arrested, and it is illegal. And it has to be properly documented. It has to be properly documented. Anybody that walks in with a prescription, you photocopy the prescription, you keep it, you record it in your poison book. That is what we call poison book.
Right.
It has to be recorded too. So when you see that a lot of pharmacies are not practicing in accordance with ethics and procedure, you know that they are also guilty.
Ah.
They are deliberately killing our youth. They are deliberately dispensing these youths. Not in even there is ethics even in their profession. There are things that they must do and there are things that they should not do. So a lot of people will realize that yes, they are pharmacists, but they ought to get money anyhow. It's just there. Let me just sell it, and we have 1 or 2 cases arrested such pharmacists, and we are right now we are prosecuting them. So for chemists, ordinary chemists know that if you go to all the villages, you see them.
Exactly.
It's over-the-counter drugs like I said. Yes, they are supposed to dispense. Things like Panadol, things like paracetamol, and these simple analgesics, so the pain relievers and all these things. That is it. No chemist is allowed to dispense a controlled drug in that store. No chemist. It's not allowed. It's only a pharmacy that can dispense in his pharmacy, a pharmacist that can dispense in his pharmacy a controlled drug, and it has to be strictly on doctor's prescription.
All right. Okay, I want us to look at the humanitarian aspects.
Yes. Now, as a result of the insurgence that is happening in the northeast, a lot of people have been displaced. We have IDPs, internally displaced persons, as a result of Boko Haram, as a result of even kidnappers, as a result of cattle, farmers and herders crisis and all these things. So it has created a lot of social problems even to the society. Because it has displaced several people, millions of people in our society today. And you go to the IDP camps, what are they doing actually? Government is trying its best to create opportunities and employment opportunities to these people, but a lot more, they are unemployed in our society. So
are any of them even employed from the IDPs?
Yeah, because some are self-employed, they are doing one trade or the other. But a lot more are there that cannot even get the resources to do the trading and all this.
And because
so
of
all they are thinking,
and all that, there is room for addiction.
And you can sometimes excuse them because the father, the mother have all perished in the crisis. They have been murdered. They are not. It's only maybe a daughter or a son that is left behind. You understand? So these are the easy prey for committing all sorts of crimes in our society. Because the moment you give them 1 naira to kill, they will kill. You understand? They will not put it on scale and weigh the consequences. So, if you like, it's a humanitarian crisis, and drug is foiling this crisis. The Boko Haram
in the midst of crisis.
Yes, drug is foiling it. In the Boko Haram camps, you've heard that the soldiers will go to their camps and see a lot of drugs. That means all the things that they've been doing, the barbaric act of the way they kill and do a lot of things, is as a result of taking in drugs. Because no human being can just kill a fellow human being when he's sound mentally. You have to be under certain influence to take somebody's life.
That's true.
You understand? So you can see the humanitarian crisis that is abound everywhere in our society today as a result of this crisis that are happening all over the nation.
Okay, so to what extent is the NDLEA to what extent do they get to try to prevent, mostly from the local village small communities that
we do a lot of
that sell these drugs, and
we do a lot of sensitization programs.
Okay.
The NDLEA fight this drug war in 2 ways.
Okay.
There is what we call demand reduction, and there is what we call supply reduction.
Okay.
Supply reduction entails what we do, our sting operations that we do, the motorized patrol that we do. We intercept a lot of volumes and tons of drugs moving on our highways. We do specific operations. We arrest drug barons. We arrest warehouses, and we seize, exhibit, and all this is. This is in our effort to cut the supply so that it will not go round.
Exactly.
We have what we call demand reduction. Demand reduction is just a diplomatic way of preaching to our community that you don't have to go always take arms. You go to areas that you see a lot of people, like the motor parks, the schools, university, tertiary. Just 2-3 days ago, we were at the base university to go and talk to their students. You understand? So talking to people, when they become knowledgeable, they know what effect this drug has on them as a person. a lot of people will drop the idea of taking drugs. You don't have to do any enforcement there because they are now well educated. They know that after all, if I take these drugs, it's of no help to me. So they will drop the idea of taking this drug. And it works. Even our prison, the correctional service these days, they are talking about it's not supposed to be punitive in that nature. It's supposed to be where you will correct the notion that they had before coming to the prison,
Right.
and educating them and even giving them opportunities, maybe in this handwork and all these things, so that at the end of the day, when they come back, they will be reintegrated back into the society and there won't be problems. So NDLA do a lot of sensitization. We go to schools, we go to mosques, we go to churches.
Oh, good. Okay.
Yes, we talk to people so that we tell them the consequences of taking these hard drugs, what it's doing to you as an individual, this drug is doing to collectively for us as a nation. So when you preach, and a lot of people get the knowledge, the education that it is of no good to them, they drop it. You don't have to do any enforcement there.
Right.
And it works,
Okay. Okay. Sir, Deputy Commander, sir.
Yes.
Maybe you have something to chip in because the boss has said so much so far.
Okay, so thank you very much. The only thing I want to talk about is the issue of the society as a whole. We cannot do it all alone.
Right.
We need people to come up with information, particularly of those who are peddling drugs up and down, so that we can arrest them and then put them into custody, or at least educate them to change from that kind of behavior. For the society to actually have sustainable environment, it has to be clean. To be devoid of criminality.
Right.
So, and then if we don't stop these drug peddlers, they come into the society, and then they are able to, distribute all these drugs here and there. It's a problem.
It is.
And then we all have to put hands together to do that. Then, of course, your organization has done your best by inviting us to come and talk,
right,
to educate the public.
Right.
That's very good. We really thank you, and we expect you
sir.
to do more of
Yes,
that.
Sir.
From time to time, apart from this one, we're always ready. So always call on us.
Okay, sir. Thank you very
I'm
much.
sure we will oblige you to
Okay.
do that. Today is a special day for us.
Yes.
I've just gone to Millennium Park, and after a walk with a lot of organizations, and we are here today. So we'll continue to do our best and see how we can rid the society of this drug menace. I think the schools, we are equally very much, going to various schools to give lectures and talk to children, so that from the beginning we get them.
Funny enough, we do that too.
So at least, like we're talking about the society as a whole now, you talked about parents who are on drugs.
Yes.
Of course, if they have a good home training, a lot of them will not even dare it. It's a part of this value system in our society today that is at the lowest web.
Yes.
So if we are able to start from the beginning with these children, I think it will go a long way to helping us. That's what I think.
Okay, thank you. Thank you very much, sir. Then I want us to look at it. Women addicts. How do you treat them? How do you treat female addicts?
We now have some female addicts in our facility, and they are undergoing a rehab program. But the women now, really, they want to overtake even the men from taking this. That is the plain truth.
That's very
Because
Whoa.
yes, they want to really. It's almost, I think, they are
Like competing.
competing.
Yes,
You understand? Because a lot of women are now married women, for that matter,
That's
are
the
into
point.
drugs.
So I
Married
learned.
women, yes. And our kids, girls on the street and ladies on the street, there are a lot of more are into this. But
This is really a
dangerous
serious
scenario is
matter.
that even married women are now taking this drug. So you are married, you have babies, you have kids, and it is expected as a mother you have to impact good values on
your
your child.
children.
But look at you as a mother doing this thing. So how it's a serious problem that we just have to do a lot of work on this thing, so that women, especially at home, generally women, both married and unmarried ones, we have to, protect them seriously. Because a woman take care of the house,
Takes care of the home.
the whole house, with the husband, which is the father.
Yes.
She takes care of herself.
And the head,
She takes care
of the children.
The children.
Yes.
So you can imagine if that woman is completely
Right.
yes, she's on to drugs. It will affect virtually, and it will by extension it will affect the whole society.
Okay, sir. Even as we begin to round up now, do you by chance have statistics of in the country, which aspect of the country we have more of this addiction?
Yes, we do. But just to give you in a nutshell, like areas like commercial areas, like Abuja is a commercial area too, is the FCT, it's a cosmopolitan town. Port Harcourt,
Oh.
Lagos, Kano, these are commercial areas. And we expect drug activity to be very, very high because of the influx of people into those areas. But ordinarily, generally, there are states that are just referred to as civil service towns and all these things. Talking about maybe you say Enugu, you say Maiduguri, Bauchi, there are no much commercial activities. So drug consumption, hard drug consumption tend to be low in those kind of areas.
Yes. Gwaripa Kado.
Area.
Yes.
Madam, I want to confess to you that we've gone there severally, and we are not going to relent. We will still continue to move and go there, and we arrest a lot. We arrest dealers with hard drugs, and they are
not giving up.
Yes. And for your information, FCT command was awarded the command with the highest number of conviction and diligent prosecution.
Okay.
It means we are working.
Right.
We've been taking these people to court, prosecuting them, and day in, day out, we go there, we still arrest more. They are not willing to dislocate, but somehow we are going to ensure that
so you will not relent.
We will not relent.
Yes.
We will continue to hit them hard.
Yes.
Sincerely speaking. And it's not only Guarimpa area, there are a lot of black spots that we identify that drug activity is taking place. But we are making our mark, and we shall continue to make it.
Okay.
By the grace of God, we will reduce to the barest minimum these activities of peddlers in the FCT community.
Yes. Thank you so much, sir. So I will ask you now for your final remarks to our listeners. At least the call has made you know that there people are listening.
Yes.
So your final remarks to that child, that addict that is out there that is hearing us, or that parent that is nursing pain in his or her heart about a child that is into addiction of drugs, or that illicit trafficker also that is hearing us right now. What would you say, or even a parent that is an addict that is hearing you? So what would you say to them?
I would finally say that parents should wake up. They have to be up and doing, and they have parenting and entails a lot of things. It's not just to bear children and just leave them at the mercy of the society.
Exactly.
Parenting is read the spiritual books, the Bible, the Quran talks a lot about parenting. You'll be held responsible. Once you bring a child into this world and you neglect the child, definitely you'll be held responsible.
Right.
Sincerely speaking.
That's what we tell them every day.
A lot of parents must wake up to see who goes out with my child. What is my child doing if I'm not at home? Who does it relate with? Phone calls that he makes and all these things. We ignore this aspect, but it's a very serious aspect that we have to imbibe it and be monitoring.
Just a second, sir. I'm not cutting you short. It just came to my mind. How do we relate this to the internet?
Yeah.
The internet, every teenager, every youth, these days.
Yes.
So
the social media is doing a lot of good and it's doing a lot of bad to our TV populace.
Yes.
Sincerely speaking, because free access to a lot of information that even our children are not supposed to get that kind of information.
Yes.
You see freely a lot of even let me sorry to say, you see even pornography on
there's no need to be
social media. Yes,
that's what it is. Yeah.
So we have to somehow be guiding our children. We have to somehow be guiding our children.
It falls back to that parental
Parenting,
guidance.
yes, guiding. You, as long as you live, as long as you live, as long as you have a family, you will continue to guide your children. The idea that my child is now married, so he's a free person and all these things, even as an adult, as long as you live, that child stays in
Still
your
your
womb.
child.
It's still your child.
Right.
You in your womb for 9 months. You
And if the child
he's
goes
still
to
a baby.
pain, you will feel the pain.
Yes, you feel the pain. He's
Yes.
still a baby.
Yes.
So guidance is
Is
has
the
to be
key.
ongoing. Every day is every hour. For those that are addicted, if they don't know that we have a facility, we have a lot of there is a lot of even private facilities outside that you pay money and you get your child rehabilitated. But we have the facility in the NDLA that is at subsidized rate, and you go, you get the best treatment there for your kids. And we shouldn't allow until when our children are hooked to that drug that you have to do a lot of work. The moment you begin to identify certain things in your children, truancy, child abnormal behavior, is dropping out of school. A lot of this goes with this thing. You see, checking your child's room, you see a lot of paraphernalia that is for taking drugs. Maybe it could be syringes, it could be ashtray, it could be this thing. And some children will apply perfume, to conceal the odor of this drug. If you see your child doing all this every day, perfume, and abnormal behavior is something that you just is clear. But there are children that are not abnormal, well behaved. When you see your child is also excessively well behaved, you begin to ask questions.
Okay.
Why is my
Right.
excessively like that?
Yes.
You begin to ask questions.
Yes.
Because I give you a story. There is this guy that went and took his cannabis, went high.
Became calm.
Yes, he became calm when he was coming into his house. A typical community in the north. He saw he-goats and some rams. They were lying low. They just lied resting. So he thought maybe it was his father. He just went down and said, "Ranke Dede," you understand? Greeting the he-goats.
Oh my goodness.
So when you see this kind of attitude, my child is excessively well behaved, try and question. Everything that is excessive, just sit down and ask question. Why is this child so excessively well behaved?
Either on the negative or on the positive.
Or on the positive. So these are the things that we want parents to be doing.
Thank you so very much. And this is where we drop today's topic. And I'll tell you that there is room for more. Like you heard the deputy commander, he has given me a white flag that whenever I need them, I can always get across to them. Thank you so much, sir. Thank you, Commander. Thank you so much for coming. We appreciate you. Mr. Mohammed Ajia, a commander of narcotics, has been the one that has been talking to us, the FCT commander of NDLEA, and is here with his assistant. I'm so very grateful, sir, for being here.
Thank you.
And I want to thank you, our listeners, for being out there, for listening to us. We hope that at least you've been able to pick something today and learn from what we have discussed so far today. And I leave you with these last words. Parents, please, if you are there, you can see that we always take it back to parents. It has to do with parenting. We keep telling you that parenting is deliberate. It's a deliberate act. It's an act of duty that is life. It's for life. As long as you are ready to have children, be ready to be a parent. Don't just bring in children, neglect them to turn into something else and be a menace to the society. Please, parents, watch out for your children. And don't be ashamed if you have a child that is malfunctioning, behaving strange, or you have even noticed that is into one kind of, probably is not an addict yet, is not addicted to it yet, and you found out that he or she is into any kind of drug. Please speak out. Speak out. Don't keep quiet, because that child needs help before it gets late. Then if you are a young man or a young lady, a teenager or a youth that is out there listening, and you are already into these things, it's not good for your health. Your health is involved. Your life is involved. Don't use your hand to take what will shorten your lifespan for nothing. So please seek for help. If you don't know where to go, call our lines after the show and seek for help. We'll direct you on how to go about it. But the most important thing is don't keep quiet. So this is where we draw the curtains for today, and family and society. I will be here again next week Saturday with another interesting topic. My name is Elizabeth Samsedi. I'm saying have a wonderful weekend. Bye for now.